Okay, it's coronavirus day 427. It's stay at home day 36. And you might not like this. But before I say anything, I just want to note for those. So I have been going on Doug Ford's Twitter and also with Instagram, and people have been saying nothing but complaining, orating. That why aren't you all opening a country? Why aren't you opening the country? Blah 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 blah. I don't see nothing different. So there's some rules, general rules that we need, that have been created, but some people actually follow these rules, but the people who are complaining and they think they can protest and think that's going to change anything, it's not going to change anything. Because maybe it's just going to make it worse. High case is going to go higher. So maybe someone, maybe a family member or a loved one or friend or somebody they might end up getting coronavirus or one of the variants because they're acting so poorly and they were being so inconsiderate. They only think about themselves and not about the entire province, the region, the community. Because you don't know who it might affect right after. So I tell you, it's who knows what's going to happen. Anything could happen. Are we clear? Okay. Now the video starts. So it is so we have today's case is higher than last. So Wednesday it was at 2,320, but now it's higher at 2,759. Okay. So 700. So where the cases are today? 774 high cases are from Toronto. Peel Region is back to high cases with 602. 258 from York Region, 147 from Durham Region, 133 from Hamilton, 110 from Halton Region, and 105 is from Ottawa. All other regions have reported under 100. 31 deaths have been reported. Okay. Similar to yesterday. variant cases. I knew this would happen. I knew this would happen. Like people were like thinking, oh, it's like not that serious. The UK variant right now is 101,232, an increase of plus 2,737. I told you sometime this week it would be reach that high or higher. 574 South African variants, which increased of plus 6, and 1,727 Brazilian variants, plus 144, and of course I don't know why they didn't do it, but and of course it's still a variant of interest, which is which is actually a pretty the problem right now. So if you look at India, thinking about it, you know. So serious that Doug Ford had to send some ventilators over to India to help the India patients. And how serious I'm talking about? I'm talking about cremations, body burnings, and India contributing to almost 50% of the world's coronavirus cases. So if you don't think that's serious enough, I don't know what hole you've been sticking your head in, but you better stick your head out of that hole. And also it's also affected Brampton and Ottawa, which Brampton Mayor Patrick Brown is not happy about, and healthcare professional Dr. Vera Etches in Ottawa she is not happy about that either. Vaccine book details are down below. I changed it yesterday because the AstraZeneca vaccines have come to a halt because of safety concerns and not enough quantities of. So it's either Pfizer BioNTech vaccines or the Moderna vaccines. Stay-at-home rules. Here we go. It has been updated. Yes, it has been updated until June 2nd. Start cursing. But if you're gonna dislike this video because I'm talking about it, instead of go complaining and protesting, think about why the government had to resort to do that. And they did this time listen to the healthcare professionals and of course data given. So this is ahead of the plan of the Victoria Day weekend, because our next big threat is Victoria Day, and I tell you, there's going to be more than five groups of 5 people, or groups of 5 people. Okay, that's okay, as long as they're not getting less than not at least there's social distancing or physical distancing. Well, I should say, because social distancing, that doesn't make sense. So, so it should be fine. But if there's a gathering of like at least more than 5, that's a concern. Because people might be like popping fireworks, or there might be drinking. That's my concern. Or partying. That's also a big concern, especially Easter and gatherings that should not have to happen. That should not have happened. And St. Patrick's Day, which they like people are literally disrespecting the Irish people and like making it a drinking holiday instead of actually celebrating St. Patrick. Whoever the dude is, you can go look it up on your own time. So as long as people are like following coronavirus regulation, like wear a mask, stay 2 meters away from, like, wash your hands or sanitize your hands, or and also physical distancing, like staying 2 meters away from each other. But unless if you don't understand metric, 6 feet. E40 made a song about that, requesting 6 people to stay 6 feet away from each other. And also in lineups, which will be outside, as long as people wear a mask and also staying 2 meters, like, physical distancing. But hell, I don't want your virus or variants. So originally it was supposed to be 6 weeks, but people making it worse, and the concern of increasing cases and ICU patient numbers. That's also something people should be actually thinking about, because it's not just what happened outside. It's also what happens in the hospital rooms. And if you know a critical care nurse or a nurse, and they are dealing with coronavirus patients daily, you should really think think about how they feel. Because I am. You should do. And because of the coronavirus cases were sort of going down to 2,073, that was the lowest of this year. Last year we have had lower, but it's increased ridiculously, and someone came down back up again, but now it's going up again. And today's is 2,759, so this is why it's going to be. So, Ontario Medical Officer of Health, Dr. David Williams, not so sure how we trust this guy, but yeah. But he said he'd like for cases to be at least under 1,000 daily, to in order for the government to ease restrictions which actually does make sense because if the government were to ease restrictions right now, and things are pretty serious right now, it could be pretty worse, and people would have a bad summer like last year, and not to mention the warning of wave 4, which may happen if people don't control their actions. Because you can't just think about like how I want things to happen. You have to think of it in sort of in a logical way. Like, what would happen if this would happen? Because we have to sort of like wait until like things are sort of like improve. Because this month we're vaccinating a lot of people. The government, the all across the country, the province, and I will be one of those people. Being vaccinated, unless if you haven't signed up yet. Because as Dr. Peter Juni has said, people can't make the same mistake as they did, and look where it got us into the third wave, which is technically the most serious one. Ouch. So Doug Ford announced that children aged 12 to 17 years old will be eligible to receive the Pfizer BioNTech vaccine starting May 31st. So that's under 18. So that's great news. So maybe the children are affected, but like this. So far, the people who are underage, technically minors, who could get the vaccine, only the reason was because if they had a specific medical condition or disease or medical condition, or you get the idea. So there'll also be special dedicated youth and family clinics throughout the weeks of June 14th and June 21. So and if you want to get vaccinated, but if you're going to get vaccinated, but you live in you're going to get vaccinated in a farther place than you live, and because there was like no options the first time you signed up for vaccines, if you try again, and you might be allowed. I ended up getting get scheduled to get vaccinated at a much closer next town over, instead of like going all the way like 1 hour northeast to get vaccinated. So don't forget about that one. Hospital. Okay, I got it, but just as a reminder, enforcement officers have the authority to break up any gatherings of any kind. So this is through if you're illegally fishing or going out to the region or having a house party or like a bush party or like basically any gathering of any kind, yeah, you'll get caught. Yeah, you'll be fine. You'll be fined $750. And sometimes, if it's worse, you might get an additional $130 surcharge. Fishers from the GTHA came over in Port Hope here, and Port Hope police charged them $880 each. They're from Toronto, Scarborough, Woodbridge, Vaughan, Markham. So you might get fined $880 through if you are caught doing a ride check, and if you were like driving for non-essential reasons. So someone who was like moving out east Atlantic, Canada, they were clear, but and actually got assistance, but. Some people from Brantford, they got fined when 5 people from 5 different locations, and they were caught in Timmins, Ontario, through a ride check by Timmins police, and yeah. And ride check is 100% legal. It's not like a random stop or anything. So, $1,000 for preventing others from following orders. So if someone is trying to is following coronavirus regulations or lockdown regulations or stay-at-home order, but there's a person who is trying to stop that person from following so that person who is trying to prevent people from doing that, they'll get charged $1,000. $10,000 for those who organized or planned the gathering or gatherings. There could be multiple. And there could be there's a maximum fine of according to government of Ontario, a maximum fine of at least $1 million in fines if it's severe, or jail time. You pay you do the crime, you get the time, you play stupid games, you win stupid prizes. Hospitalizations has sort of lightened up with 1,632 people hospitalized with coronavirus cases, minus 41. Okay, that's good. 776 unchanged since yesterday, and 568 ICU patients using a ventilator, +9. I hope it's not stressful enough for my critical care nurses. I have them in my thoughts. So long-term care home deaths is unchanged since May 11th. Staff deaths have not changed since about 6 months ago. I don't know. Someone please check. And 41 outbreaks, -2. So please follow coronavirus safety rules and regulations and stay-at-home rules. don't have gatherings of any kind, especially on Victoria Day. We warn you, don't do it. Because someone you know might be affected by your foolish actions that you care about. Because it always backfires somehow. Follow Ontario and Quebec border rules if crossing for essential reasons. Rules are like, down below in that document I have. To the incident getting considered, people, your rights aren't more important than the rest of us trying to lower coronavirus cases, ICU patient numbers, and yeah. And the prevention of wave 4 and a bad summer. And of course, don't forget about fall too. Because Dr. Peter Jr. mentioned there's going to be 3 things that's going to be coming in the fall. If the things don't like. So we better narrow it down to 2. It's the common cold, flu, and coronavirus. Stay safe.